Hi, my name is Kate Rouse, and I'm going to be sharing a presentation on antiarrhythmic agents and the heart for Nursing 312. Antiarrhythmic agents may be used when there's altered functioning of the electricity of the heart causing arrhythmias. These medications work through altering the automaticity and or the conductivity of the heart. The pharmacologic class for these medications is known as antiarrhythmics. The therapeutic class of this drug is dependent upon the specific classification of that antiarrhythmic. There's 4 specific classes based on the mechanism of action. Some medicines don't fall within these 4 classes. So there's a 5th class of medications that actually has variable mechanism of action among the drugs. These classes will be discussed further in the presentation. Action potential. So the action potential causes excitation of the heart muscle. So it's also important to understand when discussing the mechanism of action of these medications. Action potential represents the sequential change in electrical potential that occurs across the cell membrane when excitation occurs. Action potentials can be divided into 3 different parts. The first part is when the cell membrane is polarized and is resting or unexcited. The second part is depolarization, where the polarity changes and inside the cell membrane becomes positive, while the outside remains negative. Repolarization is where the cell membranes actually reestablishes polarity and returns to the resting state. There are 3 types of cell membrane ion channels that actually contribute to the electrical charges, the positive and the negatives, during the phases of the action potential. These are sodium, calcium, and potassium channels. And disorders of the ion channels, along with disruption of the flow of these current-carrying ions, are increasingly being linked to generation of cardiac arrhythmias and conduction disorders. Conduction of the heart. One aspect of the pathophysiology of the heart that must be reviewed in order to really understand the mechanism of action of these medications is the conduction of the electrical impulses. The conduction system consists of the number 1 is the sinoatrial node, where the rhythmic impulse is actually generated. That's also known as the pacemaker of the heart. The second is the internodal pathways, which conduct the impulse from the SA node to the AV node, or the atrioventricular node. The third is the atrioventricular node, in which where the impulse is from the atria is delayed before passing to the ventricles. And the fourth is the AV bundle, which conducts the impulse from the atria to the ventricles. And then the 5th is the left and right bundle branch or bundles of the Purkinje fibers, which conduct the impulses to all the parts of the ventricles. There's a YouTube video attached that will actually help understand, that can be watched at another time. So in order to understand how antiarrhythmic medications work, we must have a better understanding of arrhythmias themselves. Arrhythmias occur when there's changes to the automaticity or the conductivity of the heart cells. Automaticity is the ability of the heart cell to actually cause a spontaneous depolarization, generating that electrical impulse. This helps control the heart rate. Conductivity allows the impulse that is generated by the SA node, or the pacemaker of the heart, to travel, stimulating the heart muscle to contract, like we talked about in the previous slide. Changes in automaticity and conductivity can be caused by several different factors. These factors are electrolyte imbalances, decreases in oxygen delivery, structural damage, acidosis, drugs altering the action potential and conduction as well. There's different types of arrhythmias. They can be caused by changes in rate, changes in the stimulation location. So other than the SA node, there may be ectopic focus, or an alteration in the conduction. Changes in rate result in tachycardia, too fast, or bradycardia, too slow. Stimulation from an ectopic focus causes the heart to beat abnormally, causing like PACs, or premature atrial contractions, or PVCs, premature ventricular contractions, atrial flutter, atrial fibrillation, or ventricular fibrillation. Alteration in conduction of the impulse through the heart muscle can cause actual heart blocks and bundle branch blocks as well. 4 classifications of the antiarrhythmic medications to treat these arrhythmias are shown on the screen. They are basically based on the mechanism of action of the drug and the effect that it has. And the classification scheme that's used is called the Vaughan-Williams classification scheme that's seen there. So class 1 antiarrhythmics is the first class. It works by blocking sodium channels in the cell membrane, changing the duration of action potential. There are 3 subclasses of this medication. These medications bind more quickly to the sodium channels that are open and are not polarized, which makes them more effective in tachycardias in which the sodium gates are opening and closing more frequently. This class of medication is indicated for life-threatening ventricular arrhythmias. Therapeutic goals for this medication is slowing the conduction and automaticity. Some of the specific examples and subclasses are on your screen. Class 2 antiarrhythmics are the beta adrenergic receptor blockers that causes a decrease in the excitability of the heart muscle and a decrease in the blood pressure and the workload of the heart. This is a class of medication is indicated for supraventricular tachycardias and PVCs as well. The therapeutic goal of these medications is to decrease the heart rate, decrease the excitability, decrease the cardiac output, kind of slowing the conduction through the AV nodes. There's several beta adrenergic blockers used that are often used for hypertension as well. The 3 beta blockers on your screen are specific to used as antiarrhythmic medications. Class 3 antiarrhythmics block the potassium channels, which ultimately prolongs the action potential. The indications for these are life-threatening ventricular arrhythmias as well. The therapeutic goal of this medication is to prolong repolarization, slow things down, and the refractory period, ultimately raising the threshold for ventricular arrhythmias. Some medications are seen on your screen. The most common is amiodarone, which is often used in life-threatening emergencies as well, and that'll be discussed in detail further. Class 4 antiarrhythmics work by blocking the movement of calcium ions across the cell membrane, slowing automaticity and conduction of the impulse. These medications are indicated for a supraventricular tachycardia, atrial fibrillation, and atrial flutter. The therapeutic goals of these medications is to slow automaticity and conduction of the impulse. Medication of these classes are diltiazem and verapamil, which can also be used for hypertension as well. Here's classes of the other antiarrhythmics that don't fall within the classes due to their mechanism of action. The indication of the drug is each depending on the type of specific arrhythmia. So adenosine is another antiarrhythmic that's used specifically for SVT or supraventricular tachycardia. This medication works by slowing conduction, prolonging refractory period, and decreasing automaticity. Digoxin is another one that's used to treat arrhythmias. It slows calcium, causing prolonged action potential, kind of slows the heart rate, makes the heart more effective. Another one is donidrone, which is used in treatment of atrial arrhythmias, and it has all 4 properties of the classes, so its mechanism of action is not very well understood. One thing that is the most common and serious side effect of pretty much all antiarrhythmics is that it has the ability to develop a new or different arrhythmia. This is called the proarrhythmic effect. This is one of the most important things for a nurse to remember, and that close monitoring is required, especially right after administration of IV antiarrhythmics. These medications can also increase the duration and frequency of the type of arrhythmia or a new arrhythmia. QT prolongation may also occur, which puts the patient at high risk for cardiac arrest. The use of antiarrhythmics is associated with increased morbidity because of this effect, so it's super important as a nurse that close cardiac monitoring and rhythm monitoring is done. These are the side effects of each of the classes of medications. Many of the side effects are similar among the classes and involve the central nervous system. The side effects basically depend on how the medication works and the effect it has on the cell membrane. Here's some herbal interactions and also alternative drug therapies. So they may actually negatively interact with antiarrhythmics. So some of the herbs are seen on your screen that can actually have a negative effect and cause an increase in side effects. And some herbal therapies actually may be beneficial for treatment, especially atrial fibrillation. So fish oils and magnesium are supplements that can reduce arrhythmias. Grapefruit and grapefruit juice is one thing that should be avoided when taking antiarrhythmics because of it interferes with medication absorption, which is common with a lot of medications and can cause unwanted side effects. It's important to know anytime a patient's on any herbal or alternative treatments in order to make sure that it's not going to interact with antiarrhythmic drugs. So some cultural considerations. Cultural diversity plays a significant role in the safety of medication. So it affects beliefs about health, illness, medication, how patients interact with healthcare providers, medication adherence, as well as the physiologic effects of the medication. Some specific education that is needed in regards to antiarrhythmics is compliance and importance of taking the medications as prescribed. There's significant risks of developing arrhythmias when antiarrhythmics are not taken as prescribed. Another thing is that some cultures, ethnicities actually respond differently to medications. So it's reported that Blacks, Hispanics, and Asians have a lower risk of developing atrial fibrillation than whites. So some beta blockers are also actually less effective in Black population, and other medications should be used in first-line treatment. Here's some more information on amiodarone. As you can see, it's just specific information on this medication. This is pregnancy categories D. There's the mechanism of action, some more adverse effects, monitoring. Nurse management strategies is to make sure that there's close monitoring for adverse effects, rhythm changes, any drug-to-drug interactions, as well as patient education and compliance. Knowing a clear indication of use of amiodarone is very important, especially in the emergency setting, because it is such a high-risk medication. So proper administration, cardiac rhythm interpretation, so using it for the proper rhythm is important as well. And close patient monitoring as always. Here's some drug-to-drug interactions of amiodarone on your screen as well, and some classes. So it can interact with antibiotics, antidepressants, blood thinners, and some other medications, as you can see on the screen. Here's a research article that I found interesting in regards to this topic. It reviews the importance of proper use of antiarrhythmic medications and the connection between the classes and the mortality in post-MI patients. The Vaughan-Williams classification system of the anti-medications is reviewed in this as well. Basically, the study recommends utilization of beta blockers in all patients post-MI to reduce mortality, and it shows the effects of some of the other classes of medication. So class 1 is proven to increase mortality, class 2 is proven to reduce mortality, class 3 has no connection really, and class 4 study proved that verapamil actually reduces mortality. Here's another article that I found helpful actually in treating elderly patients, which is important for the lifespan of this medication. So this article basically associates the risk. It identified that there's no real antiarrhythmic medication that is contraindicated with this population, and that use of this medication is similar in younger populations, and the dose should just be adjusted as it would with any other medication. And so it's just a trial and error to kind of figure out what medication works best for each patient. Here's a list of my references. References continued. And I have a pamphlet that I would like to share as well. Sorry. So special considerations as prescribed with or without food, store at room temperature, avoid grapefruit juice, avoid sunlight, caution when driving, things to look for with when to call your doctor. There's some dosing as well. And the pamphlet will be attached in the document in proper formatting. Thank you.